Hello, and today we are going to be talking about the Keystone 65 Basic HMO plan for 2025. So I'm going to begin by sharing my screen. Here we have the Keystone 65 Basic HMO available in Philadelphia, Bucks, Chester, Delaware, and Montgomery counties. The premium is $0 for 2025, but on top of that, you are actually going to get paid to be on this plan. This plan is going to pay you $6.10 a month towards your Part B premium. So this is going to reduce what you are paying just for your Part B of Medicare. Primary is $0. Specialists are $30 a visit, so that has dropped. Outpatient hospital services has dropped as well. If you have an outpatient procedure, it is $300 at the hospital or $150 at any standalone surgery center. Emergency room is $110 per visit. If you get your lab work done at LabCorp, that's a $0 copay. $40 if you are needing an X-ray, $170 for an MRI or CAT scan, which is one of the lowest you will see with any of these plans. If you're in the hospital, this has remained the same, $250 for days 1 through 7. So if you're in for one day, it's just $250. If you're in for multiple days, you will never pay more than $1,750 per stay. Outpatient rehabilitation like physical therapy is $25 a visit. Over-the-counter products is $70 per quarter. Keep in mind that does not roll over from one quarter to the next. And if all of your copays for the year were to reach $7,250, that is your maximum out of pocket. That has also dropped for 2025. So next, we are going to touch on some additional benefits of your plan. Of course, you still have the dental, vision, and hearing, but that has improved as well. The dental network is now larger than it was. It's now the Dominion network. Most dentists that were currently participating with United Concordia have moved over. There's just a few that have not. I believe it's 9 in total that they're still talking to. But all of your preventative care is covered twice a year at no cost to you. On top of that, with the basic plan, you're going to get an additional $2,500 in comprehensive dental, and you will just pay 10% for fillings, root canals, crowns, and extractions, as well as dentures, even implants, partials, and some oral surgery. Blue Cross would pick up 90% of those costs until what you have paid and what Blue Cross has paid together reaches $2,500. Vision, you can get a $0 eye exam with any Davis Vision provider. There are hundreds in the area. In addition, you get $250 off if you go to VisionWorks for your eyeglasses, or you get $150 off any other Davis Vision provider. If you prefer contact lenses, there is a $150 allowance instead. Hearing services, if you use a True Hearing provider, which is a phone number that you call and they will tell you where to go, you can get a $0 hearing exam, a $0 hearing aid fitting and evaluation, and your copays with this plan are $6.99 or $9.99. So you'll notice they are a little bit less with the Essential or the Elite plan if you want to explore those options as well. In addition, of course, you still have that $300 Visa Flex card. However, for 2025, you can use this for dental, vision, and hearing, as well as for medical copays. So whether you choose to use it in one direction or the other, you have $300 that is used for medical or for dental, vision, and hearing. You still have telemedicine with Teladoc for over-the-phone conversations with medical doctors, mental health, or dermatology. You still have the OnePass fitness membership, which is even larger than the silver sneakers. You can access multiple gyms throughout the year at various locations. Next, I am going to touch on the prescription coverage with this plan. There is no deductible for the plan. Tier 1 and now Tier 2 medications are both a $0 copay. Tier 3 is 25%, Tier 4 is 50%, and Tier 5 is 33%. New for 2025, if all of your co-pays for the year were to reach $2,000, that is your maximum limit, and Blue Cross would pick up the remainder of your prescription co-pays for the year. So a really great benefit if you're finding that your prescriptions are pretty pricey. You can even sign up for their payment smoothing program if you would like to have your prescription costs averaged out month to month, and you would receive a bill directly from the plan instead of paying at the pharmacy. So at this point, the Basic HMO, they have been a 4-star rated plan, 4 stars out of 5, and that should be reevaluated within the next month to 2 months, and we will get that information out to you. So if you still like this plan, it is looking better than ever. If you want to explore other options, I am happy to talk with you as well. Thank you so much and have a wonderful day.